Hi everybody, I'm Dr. Duc Vuong. I'm a world famous bariatric surgeon, author of 13 books. Here's my medical diploma right on proud and display for you guys, just so you know where you're getting your information from. If you did not see my interview yesterday with bariatric surgeon and virologist, Dr. Terry Simpson, good friend of mine, it's up on YouTube now, so you can check that out. I'm here to take your questions. I have a couple questions that I already have prepared that I've been reading through your comments, so I'll answer those real quick. I also wanted to give you an update about this format. Now, this Sunday, this is super important, y'all. Please hit share for me. This Sunday at noon Central Standard Time, right? So what's Sunday? April 5th? Sunday, April 5th, noon Central Standard Time, or 1 p.m. Eastern Standard Time, I am going to be interviewing my good friend, Dr. Michelle Gordon, who's a surgeon in New York, just north of New York City. And she is going to tell us what's really happening in New York, behind the scenes, how she's caring for patients, and what is really the down low with the PPEs and the masks and the ventilator situation. Are patients really dying? She's going to give us the behind-the-scenes scoop from a surgeon active on the line taking care of patients. And I'm going to tell you, it's not looking good. It's not looking good. So do me a favor. Please hit share. Please put it on your calendar. I'll make an infographic for it. And please share the heck out of it. I almost said fuck. Please share the fuck out of it because it's going to be super important. Because if you think about the interview, it's going to be surgeon-to-surgeon interview. Dr. Vuong's a character. So I'll be able to kind of deconstruct what she's saying for you guys. I'll also be able to control the questions and kind of tell the story in a way that I think you'll find very interesting and very educational and very informative. So that's this Sunday. Put the date down, somebody, for me. April 5th. At noon Central Standard Time, that's 1 p.m. Eastern Standard Time, or 10 a.m. Pacific Time, right? So that's super important. That's going to be, unlike any other interview. You're not going to see this on CNN. It's not like a reporter interviewing like some buttoned up, immunologist or infectious disease expert who are just real nerdy. This is going to be me, a surgeon to surgeon conversation that's going to be very raw, and I hope you're excited by that. It's gonna be kind of terrifying, but all right. I just want to tell you about that Sunday noon. All right. Common questions. All right. Put down your questions, and let me answer them for you. A common question. What the fuck's a fomite? Fomite. F-O-M-I-T-E. F-O-M-I-T-E. Who knows what a fomite is? Fomite. F-O-M-I-T-E. Fomite. Fomite. Foam. Is it something that you shave with, Dr. Vuong? No. I need some fomite on my face, Dr. Vuong. No, you definitely don't need a fomite on your face. Fomite is actually anything that harbors a pathogen. So anything that the virus can live on. So if you see them talking about fomites, then these are surfaces that contain bacteria, or in this case, a virus, coronavirus. So what are the surfaces? We know for a fact that this virus can live for hours, several hours, possibly even days on some surfaces. Let me tell you the common surfaces. So we're pretty sure this coronavirus can live on metal for a long time, plastic, as such. The big question becomes, how about clothing? Are your clothing fomites? Your shirts, your pants? Answers, we're not sure. We're not sure, but possibly yes. And so the only guidance we have really been given is this. When you take off your clothes, do not shake your clothes, because we think that might spread it. But just take off your clothes very gingerly, unbutton it, whatever. Drop it into the hamper or drop it into the washing machine right away. If you are a healthcare worker, if you are in hospitals, whether it's answering phones, switchboards, drawing blood, x-ray tech, doctors, nurses, You need to take off your clothes. And first of all, you should have fucking changed your clothes before you left the hospital, okay? So change your clothes, your scrubs, whatever, before you leave the hospital. I think they're pretty strict on that now. And then when you get home, you need to take off your clothes, drop them in the washer, and jump in the shower. Really scrub off. Because guess what? Is your hair a fomite? Or is your facial hair a fomite? Rags, rags that you wipe things down with, do they become fomites? You have to think about that. Steering wheels, right? You've all seen people, you've all done it. Stuck in traffic, you sneeze, achoo! And then you grab your steering wheel. We've all done it. Don't lie. Don't lie, Mary. Come on, Karen. Don't be lying. So fomites, doorknobs, big one, major one, fomites, doorknobs, door handles, bathroom door handles, places where people gather in and out. Luckily a lot of these grocery stores have automatic opening stuff, but some don't. Like I went to General Dollar, there's one right around the corner, so I walked to it, and they have glass doors that you have to pull open. You have to think about that. So that's what we mean by fomites. Okay, sound good? And this is ever evolving. Another question I get a lot is, Dr. Vuong, is this airborne? So it depends on what you mean by airborne, honey. Airborne, and I don't mean that derogatorily. I'm from Texas. I grew up in East Texas. Everybody's honey, sugar pie, plum pumpkin. In fact, I don't trust you if you don't call me sugar. Okay? I'm just saying. So, what was I talking about? I don't remember. Oh, is it airborne? So yes, so the virus definitely sits on surfaces for up to several hours, maybe even days. But we know for sure when you sneeze or cough that it's airborne temporarily in droplets. We are very sure that it's in droplets. And by droplets, we mean water droplets, sneezing, coughing, right? And that can go up very far. That can travel a long distance. We're doing the 6 feet rule because to the best of our knowledge, it travels 6 feet. Honestly, it probably travels further than 6 feet. But that's just the current recommendations. Now, there's a question about whether or not it's airborne to the sense that the virus itself is floating around in the air and does not need to be in water droplets. If that's the case, then we are all fucked. I promise you, if that's the case, then we are all screwed. Why? Because these masks, first of all, regular surgical masks ain't stopping shit. First of all, you should know that. But number two, these N95 masks that you guys hear the administration, politics, news talking about so badly, it won't stop the coronavirus if the virus by itself is floating around the air. It's too small. It's too small. Now the N95 mask will stop droplets, so that's good. But if it's aerosolized, if the virus itself is floating around the air without a droplet, then it will get through an N95 mask. Which then, obviously, you guys are my audience members, so you're smart. Smarter than the average panicking bear right now. Definitely much smarter than my haters. So, surgeons, what happens when you're doing laparoscopic surgery? And is that why we've canceled elective surgeries? The answer is we're not sure, but there's a very good chance that doing laparoscopic surgery, letting the air out, might aerosolize the air, put everybody at risk. So a lot of procedures are going to open surgeries like the old-fashioned way with the big incisions. And remember, the coronavirus is a +1. That's why this is problematic. People who are still saying, what's the big deal? More people get the flu every year. More people die from the seasonal flu. Listen, you don't know what you're talking about. This is a major +1. So in addition to the flu, you're going to have 5 million Americans. Yes, 5 million cases of this before it's all said and done in America alone. 5 to 10 million. So that's a +1 on top of regular seasonal flu, on top of allergies, on top of your wife's migraines, on top of your kid who falls on the trampoline and breaks his arm, on top of the car wrecks and the accidents and the alcoholism and the overdoses and the gunshots and the stabbings, because your family had to get together and play fucking Monopoly. You know what happens when your family gets together and play fucking dominoes, right? You know what I'm saying? Somebody's getting stabbed. That's just how it works. Okay. So on top of that, we have coronavirus. Appendixes, heart attacks, strokes. On top of all of that, we have this virus that is highly contagious, much more contagious than regular flu, and much more lethal. So even if the worldwide mortality rate for coronavirus currently is about 4 to 4.5%. In Italy, it's 12%. In England, it's about 10%. In France, it's 10%. But Dr. Vuong, in America, it's only 1%. No, it's not. It's gone up. The death rate in America is over 2% now. 2 weeks ago, New Yorkers were like, hey, we're New Yorkers. I'm from the Bronx. Virus can't kill me. It's only a 0.3% death rate. That's nothing. Well, look at you now. It's 2.5% death rate right now in New York. It's serious. This is serious. But Dr. Vuong, that's just because we don't test enough. Or Dr. Vuong, that's because we don't know, it's not accurate. You don't have the denominator right. We don't have tested enough people. It's actually probably much lower. Okay, smartass, it's much lower. But even with the death rate of 1%, the seasonal flu's death rate is 0.1%. So this coronavirus with a death rate of 1% is 10 times more deadly. And 10 times more deadly times a big ass number, like 5 million, 10 million, is a lot of dead people, yo. So currently we're running around 2% death rate. But what if we jumped up? What if we keep going and we end up becoming like the worldwide average of 4%? Dude, 4% of 5 million people, 200,000 dead people. As a +1! Dr. Vuong, more people die of car wrecks, heart attacks, cancer. A +1, fucker. Are you listening to me? We can't handle that in our hospital systems. All right? Okay. Next thing you need to know is this. I get this question a lot. Obesity. Dr. Vuong, you're a bariatric surgeon. Why are you talking about coronavirus? Dr. Vuong, why? I came to your page because I wanted to learn how to lose weight. I wanted bariatric stuff. I wanted you to be supportive. Well, that's your fucking problem. I'm telling you because guess what? What is the #1 risk factor for bad outcomes from coronavirus? Anybody know? Because half of y'all are going to be like, old age. Dr. Vuong, it's old age. According to the Chinese data, it's old men who smoke. No, fucker. It's morbid obesity. The answer is morbid obesity. And not like super big, like 50 pounds overweight. Like a BMI of 30. That's a 40 pounds overweight as a BMI of 30. A BMI of 30, yeah. So not super, super heavy, man. Not 600 pound life shit. You know, not big medicine stuff. Garth Davis is a friend of mine. I also know Dr. Nels Arden. We practiced at the same hospital for a little bit. So I know the 600 pound doctor, man, let me tell you. Morbid obesity is the #1 risk factor for poor outcomes. A recent literature, look at ICU patients who were on ventilators, and 80% of them were overweight. 80% of them were obese. 80%, y'all. 4 out of 5 people were obese that were on the ventilators. And most people don't get off the ventilators. If you have coronavirus and you're on the ventilator, the death rate is about 70% mortality, death. If they have to put a breathing tube in you, 70% to 75% death rate. And Dr. Vuong, you are so fear-mongering. Don't you know people leave the ICU? Yes, I can do math. 25 to 30% of people on the ventilator with coronavirus will leave the ICU. But their lungs are going to be fucked. Their lungs are going to be scarred up. They're going to have all sorts of stuff, problems lingering. We know. How do we know? Dr. Vuong, you're so negative. You're so fear-mongering. How do you know? Because we know from H1N1, yo. We know that there are still patients who suffered swine flu, and you guys forgot H1N1 was the swine flu. Hurt a lot of people, and it was not nearly as lethal. But now we're dealing with young people who suffered H1N1 and who require supplemental oxygen. They have to walk around these oxygen tanks. They have no reserve. They can't breathe. They're at risk for pneumonia. They're always at risk. So this is going to happen to a large percentage of those survivors. Dr. Vuong, don't you know more people survive than die? Well, duh, that's what a death rate of 4% means. That means 96% will survive. But how many more people are going to have permanent lung damage? How many more people are going to have heart disease because they had a heart attack from coronavirus, or they suffered a stroke from coronavirus and now they can't move one side of their bodies? Now, Dr. Simpson brought up another good point. What about all those people who've been putting off healthcare because they're scared that their headache turns out to be a brain tumor, that their rectal bleeding turns out wasn't hemorrhoids at all, it was a rectal cancer? What about all those people who've been putting off the belly pain because they think it's a bad seafood when it's fibroids or uterine cancer or ovarian cancer or ruptured appendix now because they don't want to go to the hospital, to a system that's already taxed? What about this? What if you have a heart attack or you have a stroke and there's no ventilator for you? How do you justify that death rate? How do you count that in the death rate? See, these are all questions for the epidemiologists and for the infectious disease guys. Not for us. Not for me. Listen, I've told you, I'm retired. I had the ability to walk away from surgery because it's hard. That life is hard. I still keep in contact with my colleagues and my friends. I still keep up to date what's happening in the literature. I just don't see patients anymore because I can do this. I can help the millions of y'all who are going to see this video later. I can touch more people. If one person hears me call them a fucker and stops and says, honey, what are you watching? Who are you watching? Hey, comment if that just happened. Your husband was like, who the fuck you watching? He's a doctor? But I got him to stop and think like, oh, well, maybe I shouldn't go outside. Maybe I shouldn't go visit my grandmother. Then I made a difference. Does that make sense? And y'all are my people. The morbidly obese, the people who've had weight loss surgery. You guys are the ones at highest risk. I am sorry that there has been a change to the programming. I am sorry you're disappointed that I'm not talking about weight loss surgery. That we are under temporary, duress right now. Right? This is called life. It throws us curves. Let me give you a couple other curveballs before I take some more questions. Once your loved one, your husband, your wife, your grandmother, once you're in the hospital and you're in ICU, there are no visitors. No visitors are going to be allowed. There are no fucking waiting rooms. You get that, right? There are no more waiting rooms. You're going to be in ICU, or your mom's going to be in ICU, and she's going to be talking 1 second. Next day, she's going to be breathing with a nasal cannula. Next day, that evening, she'll need a rebreather. And that night, she'll be intubated. And you'll be at home. And you won't get to see her. And then she'll be on the vent for 2 weeks. And then she'll die. That's what's going to happen. That's where we are, guys. There are no waiting rooms. You don't get to go in and say goodbye. There won't be I don't even know the status of priests. The last time I heard about a priest or somebody giving last rites or a pastor or someone praying, like they had to gown up. We don't have enough PPE. We don't have enough personal protection equipment for people to give you last rites. And if you are particularly religious, you know what last rites means to you. I mean, I'm not particularly religious, but I honor you for your faith. But I'm just I'm telling you what's going to happen if we don't take this much more seriously. If we don't stay at home. If we don't tell our loved ones to get their shit together. To just put up for it. And listen, Easter is going to be bad. The next 2 weeks is going to be bad. I want to give you some good news real quick. But it looks like we're turning the corner. But I don't want you to... We're turning the corner because you guys are starting to stay the fuck home. 2 weeks ago, I did a poll. Hey, how serious do you think coronavirus is, or do you think it's overhyped? 80% of y'all said it's overhyped. It's media. I'm not worried at all. Today, I did the same poll. Completely reversed. 88% were like, dude, this is not hype. But there's still 12% that's like, nah, this is still hype. We're still overreacting. We're going to destroy the economy. Okay. All right. I don't know what to tell you, man. I don't know how to convince you. Just because it hasn't come to your little town, your neck of the woods, it's coming. It's coming. It's too much of a drain in our system. And now we have law enforcement issues. We have first responders getting sick. Nurses are getting sick. We have started a list of doctors who have died from this coronavirus. Just doctors, not nurses. Do you know how expensive it is to replace a doctor? How much training, how much schooling, how much education? It's not the education, it's like, do you know how expensive a cadaver is to learn anatomy, to be able to operate on you and to do surgery, and you won't stay the fuck home? You think this is a joke? So this Sunday, for those of you just joining in, I'm doing another interview with a surgeon friend of mine, Dr. Michelle Gordon. She is actually a surgeon. She's actually in New York, on just north of New York City. She's taking care of these sick people. And she's going to give us the down and dirty, the real stuff, behind the scenes, what it's like to die with COVID, what it's like in the ICU. Is there really a problem with the mask? Is there really a problem with the ventilator? One person says, oh, we're out of ventilators. Another person says, oh my God, there are thousands of ventilators. We're going to hear the real story from somebody who's on the front line. So that's this Sunday, April 5th at noon Central Standard Time, 1 p.m. Eastern Standard Time. Okay. Let's take a couple questions real quick. All right. Thank you guys for watching. Thank you guys for sharing. Yes, 911 deaths, truck drivers. Thank you. Yes, thank you, truck drivers. Thank you, our grocery store girls, clerks, men, women, stockers, shelf stockers. You guys are really helping us. All right. Haters can go kick rocks. I don't really fucking care. Hit share and then get the fuck off. I don't care. All right, Tom Byrne. What determines if a person has a mild case or a severe case of the virus? You know, that's a good question. It's really, there's a lot. So there's the virus, and unfortunately, we know that there's at least 2 strains of the virus, an L and S, and probably several variants of it now. So there's the actual virus, which one's more deadly, not deadly, and then also the host. We call it the host. The virus lands on me. I'm young. I'm thin. I don't have any high blood pressure, diabetes. I'll probably get over it. I've had friends who are like, Doc, I had the worst flu at the beginning of March for like 2 weeks. I thought I was going to die. And I was like, you probably had coronavirus. You just never tested positive, right? So there's the host factor too. Now, what puts you at risk, Tom? Like, if you're overweight, definitely. If you're over 60, for sure. It used to be 80, definitely over 80, but that number is getting lower and lower. It used to be 65. CDC still says 65. I'm telling you 60 because we are seeing patients who are in their 40s and 50s getting intubated. So advanced age, 60 or 60 plus, morbid obesity is your number one risk factor, and not super. We're talking 40, 50, 60, 70 pounds overweight. Diabetes is a definite risk factor because that hurts your body to fight infections. High blood pressure is a definite risk factor if you have high blood pressure. Any pulmonary issues from the past, you had COPD, you're already on oxygen, you have really badly controlled asthma, you're an H1N1 survivor, you've had a lung resection for a polyp or a cancer, any sort of lung issues is a risk factor. And sleep apnea, any three, if you have three of those, you're at super high risk. You better stay the fuck home. You stay home now. You go now. You've been here for an hour. You go home. I've been waiting for years to do that impersonation. And I can do it because I'm Asian, so you shut up. Go home. That's the best thing you can do, is isolate yourself. Wash your hands. Stay away from your grandmother. Stay away from your loved ones who are immunocompromised. So if you're under chemotherapy, if you take medicines that drop your immunity, okay? I had a question. Somebody asked about masks. Regular masks probably won't help you keep you from getting it. It will definitely shield if you sneeze or cough. Then it will shield it. Because here's the big controversies. Because someone's sitting here yelling at the screen right now. Comment if this is you yelling at the screen. But what about asymptomatic carriers, Dr. Vuong? You should wear a mask because you're asymptomatic. Oh, God. Yeah, you're right. So asymptomatic carriers, we think, make about 20 to 25% of people. We don't know for sure. Why not, Dr. Vuong? Because they're fucking asymptomatic. We don't know. And we're only testing people that are symptomatic. So we're guessing. We're guessing on that number. But probably about 20-25% are asymptomatic. And yes, it's true. So you can pass on this virus without having any sort of symptoms. So in that case, you might want to wear a mask to limit how far you sneeze or cough. But it's still up to the individual person to stay that 6 feet away. Wash your hands. Social distancing just means when you're out, stay 6 feet away. It doesn't mean stay locked up inside. I still go for walks with my daughter and my girlfriend every night. And we were at the neighbor's house. I wasn't, but they went to the neighbor's house, maintained 6 feet distance. The kids ran around the backyard. You know, you wash the hands when you go over. You do the gel. You do as much as you can. At the end of the day, you gotta live your life. Dr. Vuong, you're being irresponsible. I did a plant exchange, so I love to garden. For those of you who are new to me, you can check out the plants. So I can, I've got my plants set out, and I wiped off the containers with, the steri wipes, and I put down on a table some plants, little potted plants, and it said, hey, free plant exchange, take one, bring one. And that's the idea. And some people were like, they lost their brains. They lost their shit over that. Like, Dr. Vuong, that's irresponsible of you. As the physician, don't you know you shouldn't be doing this? Really? I wiped it. You think, like me doing this little plant exchange, is that more or less risky than you going to the grocery store? Think about it. You walking around in a grocery store with 100 people. You standing 6 feet away from 100 people in a store. That thousands of people that day have touched that item you're about to do. You think Lowe's or Home Depot has wiped off their little garden center thing that you just handled? Come on now, let's get real. Neighbors taking care of neighbors. Now, obviously, if you're in a hot spot like New York City or someplace like that, you definitely don't want to be doing that. But you definitely want to be staying inside, really limiting your contacts. But for the rest of America, Nebraska, Wyoming, Omaha, Houston, Texas is still relatively, unaffected. I'm just smart about it. So then I've had 2 people drop off plants. I had one fucker take a plant, not drop anything off yet. Hopefully he'll come back. But, before when the new one comes, I wipe it down so that the next person who might want it, it's clean, right? And I had one drop off a plant today. I was like, I'm keeping that one. So I wiped it off and took it inside the house. So you just have to use your noggin. You don't have to panic. Just use your noggin. What are the things? Good questions. People ask about zinc supplements. Zinc might help. Vitamin D might help. Vitamin C. It's always good to kind of try to support your immune system. There's no real science behind elderberry or I take elderberry when if I ever feel like I'm getting sick, but I haven't been sick in a long time. But I like giving an elderberry pill to my daughter. Some people are confused about whether or not this is good or bad for coronavirus. I'm telling you, just listen to me. Getting too close to somebody is what's bad for coronavirus. Everybody wants to talk about these little supplements and things and different types of little therapies. Like, dude, don't miss the forest for the trees. Do the big things that make the big difference. Or do the little things that make the big difference, right? The little things like social distancing, hand washing, staying at home. Social distancing means keeping 6 feet apart. That's all that means. So being responsible. So those little things make the big difference. Taking all these little herbal supplements, whatever, yada, yada, yada. Do it if it makes you feel better. We can't tell you one way or another. There's no study. That's what novel virus means. Novel means new coronavirus. Ibuprofen is probably overblown. Probably won't be an issue, but people want to make a big story out of nothing. I'm telling you, stay your ass at home. Now, I'm going to run and have dinner. Love you guys very much. Thank you for all the questions. Keep coming. Keep dropping them. Hopefully I got to your question. Y'all stay safe. I'm going to edit down this video. I won't edit out the F-bombs. I'll put it up on YouTube so you can share. Please hit share for me if this has been valuable, if it's been entertaining, if I've actually made you stop and think, if maybe you think that your kids could relate to a cussing doctor more than a suit and tie sort of guy. Please hit share. It's them we're trying to help and save, and keeping from spreading. The millennial generations are the ones who are going to end this pandemic. I promise. Listen to me. I'll say it one more time. It's the millennial generation that are going to end this pandemic. They're the largest generation, right? They're the ones that are used to socializing, but they're also the ones that are used to socializing on social media. And so they can share good information. They're the ones more likely to hit share, tag, make a follow-up video about this. So coronavirus will be defeated by the millennials. And so we need to encourage our millennials who are now getting fucking old. Your fucking millennials are old enough to know better to, help in this war and not be a prick, right? So, all right. Love you guys very much. Keep the questions coming. I read through the comments and I will get, hopefully create good content for you guys. Remember, lastly, this Sunday, April 5th, I'm interviewing one of my friends, Dr. Michelle Gordon, who's an actual surgeon taking care of patients in New York right now, and she's terrified. And she's going to give us the real scoop behind the scenes about masks, ventilators, sick patients, how are people dying, what's really happening, and no fluff. You're going to want to put your big girl panties on, your big boy britches on. You're going to want to have earmuffs. If you don't like, if you think I'm fear-mongering or this, then don't tune in. Dude, show some respect to Dr. Gordon, who is in the front lines taking care of your family members. Sunday, April 5th. Tag somebody, tell them to tune in Sunday, April 5th, noon. Central Standard Time, 1 p.m. Eastern Standard Time. Love you guys. Stay safe, everybody. God bless our healthcare workers. Bye.